You're the New York City Health Commissioner, day 2 formally on that job. What's your message to the city as you take over this office?
Well, my message to the city is thank you. Thank you for entrusting me for this great responsibility. I realized when I took the job, there's only been 44 people to have this job. I'm the 44th. And the awesome responsibility to protect and promote the health of 8 million people is one that I take very seriously, but it's also with a lot of joy. This is the work that I've dedicated 20 years of my life to, and I really love what I do.
Where do you think we are COVID-wise right now? It's a beautiful day, so if you walk around Manhattan right now, you'll see thousands of people out. Many people have left the mask behind. It sort of has this post-COVID feel, but that, from my own knowledge, is a little bit misleading. I've been to the state's lab up in Albany. I've been to the city's pandemic response lab. How concerned should we be right now that this is only a lull?
I think we are more prepared than ever to respond to whatever comes our way, and we have a very clear way of which we're making decisions. We published a color-coded risk scale that tells us, that we're in a low-risk environment currently. So I'm not surprised and very, very thankful that throughout the hard work we've done for 2 years, New Yorkers are finally able to get back out on this beautiful day and enjoy themselves in an environment that, frankly, too many of us have not seen for the last 2 years. And so, look, I think we're ready for whatever happens, whether cases go up, whether things change. We're grounded in the data. We're looking at that every morning, every day, making our decisions based on that. New York, we're being very transparent in the way we're making those decisions. We publish all of our data online, and we're in a fundamentally different place than we were 2 years ago with all the tools we have in our toolkit.
There used to be a magic number a year and a half ago about 3% positivity would close the schools. This was pre-vaccine, and I know that number is gone. And you get asked all the time about whether there are specific benchmarks. But is there one particular data category that you'll be looking at most closely? I would guess it's hospitalizations.
I think that's one of many. I think it's one of several that are really, really important. And we're aligning our risk scale with the CDC guidance, and also understanding that we're the most densely populated city in the country, and we have some unique factors. Hospitalizations are really important. Cases remain important. Certainly bed capacity remains important. So we're tracking all of those things, and look, we've got an early warning system. If we start to see things moving in a different direction, we know exactly what we need to do at a government level to respond, and we also know exactly the advice we need to give to New Yorkers about what they need to be doing in their individual lives.
How concerned are you that if there is another uptick this spring, this summer, this fall, that New Yorkers won't comply with advice because they're sick and tired of COVID?
Well, I would say that, we're all sick and tired of COVID. I totally understand where people are coming from. It's been 2 years of shifting guidance, shifting information. It's hard. This is hard. What we've been through is hard. And so I want to start by saying I understand. I get it. I want nothing more than to sit here with you, Andrew, one day and say we're done with COVID. But I also know we need to be prepared. And frankly, New Yorkers are more prepared than just about any city in the world. And why are we so prepared? Because we have administered 17 million vaccinations. We have 77% of our population fully vaccinated. We have saved almost 50,000 lives and averted 300,000 hospitalizations as a result of that fantastic campaign. Our bulwark against whatever this virus throws at us remains vaccination. So if you're not fully vaccinated, if you're not boosted, I encourage all New Yorkers to go out and do that today, because that remains our best tool, our best key to reopening our city, reopening our economy, and just getting back to some semblance of normalcy.
If we are at status green, low risk right now, 1.35% positivity, what's the medical argument for keeping the private vaccine mandate in place?
I think exactly what I just said. Maintaining our high levels of immunity across different categories of New Yorkers, whether it's people who are employed in the private sector, city employees, the general public in different ways. We want everyone to be vaccinated because that's our best bet to respond to whatever this virus throws at us. If there's something that, if it's taught us nothing else over 2 years, is that we don't always know what's coming next, but we do have tools in our toolkit to keep ourselves, our communities, and our families safe.
And just one more thing on that topic, then I'm going to move on to mental health, is on the private employer. It got a lot of New Yorkers' attention because this involves professional athletes like Aaron Judge and the Yankees and the Mets. Is there any possibility that it's lifted if the numbers stay good in the next month?
I think the fact that we have had a nearly full NBA season without interruption. Last year we had cancellations and interruptions. The fact that we're talking about a full baseball season without interruption is because of vaccination. It's because everyone is getting vaccinated, and because in different ways we've mandated it, and because our levels of immunity as a result, as a population, are high. And so, we're following the data every day. We'll make adjustments as we go, but I would say that, getting people vaccinated, ensuring that people are vaccinated, is the best way to protect ourselves and to have all the sports seasons we want. And as a sports fan, I want nothing more.
Yankees or Mets?
Cubs. I'm from Chicago originally.
This is the plot twist of the interview.
Plot twist.
How are the Cubs looking this year?
I don't know. You took Rizzo and you took my guys from our World Series team, but I don't know. It's a transition time, let's say.
You, in your statement that you put out on your first day on the job, talked about two things that New Yorkers don't always hear about. One is equity and one is mental health. What are we seeing in terms of mental health across the city, whether it's the homeless population or upticks in subway crime or EDP incidents? It's very troubling.
I think we've all been through this incredible trauma. We've had forced isolation, the effects of which we're just starting to unpack. And the populations that certainly I'm most concerned about are our children. I'm the father of 3 school-age kids, and I've watched every day when I get home how this pandemic has affected their social and emotional well-being. And of course, people who walked into this pandemic with pre-existing mental health conditions and substance use conditions have been really isolated and impacted by this, increasing rates of homelessness, increasing rates of hospitalization as a result. And so we have a mental health crisis on our hands, and it's going to require an all-hands-on-deck approach to really tackle it.
You also addressed making sure that the city heals as a whole and that key neighborhoods, communities, segments of the population aren't left behind.
Yeah, that's right. I mean, one of the lessons of COVID, but certainly predates COVID, is that we've got deep-seated inequities in our city. We're one of the most unequal cities in the country and one of the most unequal countries in the world, and that plays out in all of our statistics, health and social and economic. And the pandemic has certainly reinforced that, exacerbated that. The people of color in certain communities in New York City have borne the disproportionate burden of cases, of hospitalizations, and certainly of tragic deaths. And so I'm proud here at the health department that in response we've really targeted resources, outreach, community partnerships, understanding that government sometimes is an enabler, and we can partner with community organizations that have long-standing relationships and trust in order to deliver key life-saving services like vaccination through our public health core program, or to deliver key messages about COVID, about how to keep those communities safe in the languages and in the media that most meet their needs and meet them where they are.
And yet it was pretty interesting. In his exit interview with the New York Times, Dr. Chokshi said he felt like the health department didn't go far enough, but particularly in predominantly African-American neighborhoods, to get the message across.
I think we can do more. We can always do more. These inequities weren't created overnight. They're not going to be solved overnight. I think we've learned a lot of lessons. Public health as a field has been under this massive existential stress test, and we have a lot to be proud of. I rattled off those statistics about how many lives we've saved, but we've also been through incredible trauma and stress, and there are things we need to invest in, like our workforce, our data systems, our communications, and our policy work. Public health has been underinvested in for generations. We spend 3 cents on the dollar for every health dollar on public health versus healthcare. That tells you what American society values. This is our moment to say never again. We are going to create lasting public health infrastructure that will prevent us from ever having to face the kind of tragedy we face with COVID-19.
Last 3 questions. Eric Adams has only been on the job for a couple months, but do you have a sense of what the health commissioner-mayor relationship is, he says he goes over the data every day. Is that you saying, boss, here's where we're at? Is it a conference call? What's the engagement like?
Every morning, 8:30, we're on a call, running through the data, running through the key decisions we need to make based on that data or not in a low-risk environment, things we want to watch for, things we're monitoring, looking ahead. So we're grounded in the numbers every morning. That's where I start my day. And it's where he starts his day, which should be hopefully reassuring to New Yorkers that we're following the science. And the evidence is clear. We reopened schools, we made it through the Omicron wave, we put out mandates, and we released a state-of-the-art antiviral distribution program all in the last 2 months in the Adams administration. So we are grounded in the data, we're grounded in the science, and that's our home base. There's a lot of noise with COVID, and certainly Dr. Chokshi faced a lot of that noise. I'm learning that there's a lot of noise around this, but when you ground yourself in the data and the information, I'm an epidemiologist by training as well as a physician, that's a home base where you can make sound decisions for people and for the entire city of New York.
How close are we, in your view, as an epidemiologist, to COVID becoming endemic instead of pandemic?
I think that it will not surprise me if at some point we live with COVID to the extent that we need annual vaccines, annual boosters, much as we do for flu or other annual diseases. We're not there yet. We're not talking about that yet. We still are seeing high enough levels of community transmission to the point where that really shouldn't be on people's minds at the moment. But I will not be surprised if that is in our future. However, I'll say that with a massive tablespoon of salt, because I know that people who have made predictions throughout the last 2 years have ended up with a lot of egg on their face, and so
along those lines, last question is, do you sense that we are headed for another wave?
I think we're prepared, and we're watching data not only here at home, but watching data from other parts of the world. We're looking at the numbers in Asia, we're looking at the numbers in Europe, and we're ready to respond. Right now, we're not seeing anything concerning that tells me a massive wave is coming or any sort of wave is coming. But every day, when we ground ourselves in that data, that gives us a pretty good bird's eye view of what we should be looking out for every day.